Trisomy is a genetic disorder characterized by the presence of an extra chromosome in the cells of the body. This condition can lead to various developmental and medical complications, depending on the specific chromosome involved and the severity of the trisomy. In this video, we will explore the different types of trisomy, their causes, symptoms, diagnosis, treatment and prevention options, and address frequently asked questions. By the way, welcome to our channel. Don't forget to thumb up and subscribe. Types of trisomy. Trisomy 21, Down syndrome. Down syndrome is the most common type of trisomy, characterized by an extra copy of chromosome 21. Individuals with Down syndrome often exhibit distinctive physical features, developmental delays, and intellectual disabilities. However, with early intervention and support, many people with Down syndrome lead fulfilling lives. Trisomy 18, Edwards syndrome. Trisomy 18, also known as Edwards syndrome, occurs when there is an extra copy of chromosome 18. This condition is associated with severe developmental and medical issues, including heart defects, organ abnormalities, and a shortened lifespan. Most babies born with trisomy 18 have a low chance of survival beyond the first year of life. Trisomy 13, Patau syndrome. Patau syndrome, or trisomy 13, involves an extra chromosome 13. Like trisomy 18, this condition is associated with serious medical problems, such as heart defects, brain abnormalities, and cleft lip palate. Most infants with trisomy 13 do not survive beyond infancy due to the severity of their health issues. Sure, there are some other trisomy syndrome. Trisomy X, triple X syndrome, is characterized by females having an extra X chromosome, often leading to mild developmental delays or learning disabilities. XYY syndrome, where males have an extra Y chromosome, typically doesn't cause significant physical or intellectual impairment, though some may experience behavioral issues. Trisomy 16 and trisomy 22 are usually incompatible with life, resulting in miscarriage. But in rare cases where survival occurs, individuals face severe developmental challenges and physical abnormalities. We will delve into these trisomy disorders in detail in our future videos, one by one. Causes of trisomy. Trisomy typically occurs as a result of chromosomal abnormalities during cell division. However, certain factors may increase the risk of trisomy, including advanced maternal age, exposure to environmental toxins, and underlying genetic conditions. Symptoms and signs. The symptoms of trisomy vary depending on the specific chromosome involved and the individual's unique genetic makeup. Common signs may include characteristic physical features, such as low muscle tone, almond-shaped eyes, and a single crease in the palm of the hand. Additionally, individuals with trisomy may experience developmental delays, cognitive impairment, and medical complications affecting various organ systems. Diagnosis and testing. Prenatal screening tests, such as ultrasound and maternal blood tests, can help identify potential signs of trisomy during pregnancy. If an abnormality is detected, diagnostic testing, such as amniocentesis or chorionic villus sampling, CVS, may be recommended to confirm the diagnosis. In some cases, trisomy may also be diagnosed after birth based on clinical features and genetic testing. Treatment and management idea of trisomy. While there is no cure for trisomy, early intervention and supportive care can help manage symptoms and improve quality of life for affected individuals. Treatment may involve medical interventions to address specific health issues, such as heart defects or respiratory problems, as well as therapies to support development and enhance functional abilities. Prognosis and Outlook. The prognosis for individuals with trisomy varies depending on the specific type and severity of the condition. Some forms of trisomy, such as Down syndrome, are associated with a relatively good prognosis and a normal lifespan with appropriate medical care and support. However, other types, such as trisomy 18 and trisomy 13, are often associated with more severe complications and a shorter life expectancy. Coping and support with trisomy. Coping with a diagnosis of trisomy can be challenging for families, but there are resources and support services available to help navigate the journey. Support groups, online communities, and specialized healthcare providers can offer guidance, encouragement, and practical assistance to families dealing with trisomy. Prevention options of trisomy. Preventing trisomy anomalies can be challenging because many cases are caused by genetic factors that are beyond our control. However, there are some steps individuals can take to reduce the risk. Genetic counseling. Seek guidance from a genetic counselor before conceiving, especially if there's a family history of genetic disorders or increased risk factors due to age. Prenatal testing. Undergo early screening tests like ultrasound and blood tests during pregnancy to detect chromosomal abnormalities, enabling informed decisions. Healthy lifestyle. Maintain a balanced diet, exercise regularly, avoid harmful substances like tobacco and alcohol, and manage stress to promote a healthy pregnancy. Preconception care. Ensure optimal health before pregnancy through regular medical checkups, managing chronic conditions, and taking prenatal vitamins with folic acid. Avoid certain medications. Consult with a healthcare provider before taking any medications during pregnancy to avoid potential risks of chromosomal abnormalities. Screening for genetic disorders. Consider genetic screening tests if there's a family history of specific trisomies or chromosomal abnormalities, helping in family planning decisions. While it's not always possible to prevent trisomy anomalies entirely, taking proactive steps to minimize risk factors and seek appropriate medical care can help support a healthy pregnancy and reduce the likelihood of chromosomal abnormalities affecting the developing fetus. Trisomy is a complex genetic condition that can have profound effects on individuals and families. By understanding the causes, symptoms, diagnosis, and treatment options for trisomy, we can better support and advocate for those affected by these conditions, promoting acceptance, inclusion, and quality of life. Frequently asked questions about trisomy. What is the most common type of trisomy? Down syndrome, or trisomy 21, is the most common type of trisomy, affecting approximately 1 in 700 births worldwide. What is the life expectancy of individuals with trisomy? Life expectancy varies with trisomy type. Down syndrome can approach normal with care, while Patau and Edwards syndromes often shorten lifespans due to severe complications. Is trisomy curable? Trisomy conditions are not curable as they are genetic disorders caused by an extra chromosome. However, treatments and interventions can help manage symptoms and improve quality of life. What support services are available for families dealing with trisomy? Families dealing with trisomy can access a variety of support services, including support groups, online communities, educational resources, and specialized healthcare providers to help navigate the challenges and uncertainties associated with these conditions. Thanks for watching. Take care and stay safe.